Staker here at Westside-Medical. Today we're going to go over how to rehab those chronic ankle injuries that are like a year, 2 years, whatever, down the road. What you need to have is you can get some voodoo floss here, invented by Dr. Kelly Starrett. It's great for working out the inflammation as well as kind of flossing the adhesions. You need a band like this. You can get these at Westside-Medical. A wobble board is a great thing to have. If you don't have a wobble board, you can use a pillow. First, let me show you how to put this voodoo floss on. So the reason why you use the voodoo floss is, like for me, I sprained my ankle 11 times. What happens is when you first sprain your ankle, like the first 12-24 hours, you get all that inflammation. That's trying to clear up the damaged tissue as well as bring in the healing factors. And then what happens is you have all this scar tissue that's laid around the ankle to kind of help support it, and that's why you want to start doing rehab exercises right away to make sure the scar tissue is aligned properly in the proper stress patterns to help create more stability in the foot. So then you have that repair phase lasts probably about anywhere from like 4 to 12 weeks depending on the severity. And then from that 12th week all the way to a year, your ankle remodels. Whereas you keep doing exercise with it, it gets stronger, the tissues mold where it needs to be. But from that 1 year on, like a lot of ankles, they have just chronic swelling and you still don't have that range of motion. For me, I'm a perfect candidate for this kind of treatment. So what you use this voodoo floss here, and it's going to compress the tissues, and that compression is what's going to help squeeze that inflammation back out of that joint that's been there for a long time. Because how you clear inflammation, it's cleared by compression as well as muscle movement. So we'll demonstrate here. To put on the voodoo floss, can you see it, buddy? You're going to wrap the ankle here. You want probably about an inch overlap. And you can go from anywhere from like 50% tension, like if you're going to have it on for a while, all the way up to about 70 to 80%. If you do like the 70 to 80% tension, you probably want to have it on more than like maybe like 2-3 minutes. And that tension is going to be there to help really floss out the adhesions. Versus what I'm going to do right now is going to just be more for compression to squeeze out the fluid. So I'm going to have it about 50%. So as you wrap it, you want to overlap probably about an inch there. You want to wrap it toward the heart, and that's going to push the fluid back into circulation through here. So wrap it like this, and then kind of finish up through here. Then you just take the end and you're just going to tuck it in like this. So now I have this compression. It's going to squeeze all out that inflammation. Now I'm going to put it through a range of motion. So you're going to step on your wobble board here first. Can you see that one? Mm-hmm. You're going to start with rotations. You work about both directions. What you want to do is just keep working it. And it's going to eventually start to kind of burn as the muscles get fatigued. And then you're going to just do a straight calf stretch. We're going to step and hold. You can do this calf stretch, you can hold for about 2 minutes. But you want to just keep repeating, go through this range of motion. And we talked about, like, there's 2 ways to use this voodoo floss band. Like right now I have it at 50%, and that's just compression to work out the inflammation. And if you tighten it more to like 70 or 80% where it's really tight, this is going to kind of floss out the adhesions. So when you have an injury, all this scar tissue is kind of haphazardly laid down. As you go through the motion, it's going to get tight, it's going to pull, it's going to kind of just clear out all the adhesions for you. So once again, you're going to work it, just rotate it, just work the other direction, and then do your calf stretch. And when you do your calf stretch, you want to make sure you kind of like squeeze your foot into the pad, into the board. So when you squeeze, it's going to tighten these arch muscles up here because you don't want this arch to stretch, you want this back here to stretch. Good. Another way you can work it, which I like, is besides just doing the rotation, you can work just the dorsal and plantar flexion. It's right through here. That's just going to just pump pump that tissue. Kind of like my school of thought is too, is as you do this and you tear up those old adhesions, you're also going to stimulate probably a little bit more in some new inflammation. That new inflammation is going to bring in that blood, oxygen, and its healing factors to help work the ankle. Also part of this too is if you have it tight and you do this, you kind of occlude some of that blood flow. So as soon as you take it off, the blood's going to kind of flush in there and help to kind of pump it out also. Good. So the next step is, you take this band you get from Westside. Now this is absolutely awesome because my ankle, I have an actual kind of like a little bit of a spur in my tibia and the talus here. So you want to put this band right on the tibia. And this is going to actually pull that tibia back, and you're going to step forward. I like to use this here to hold it. And you're going to bend your knee too, and that's going to really get that posterior, all those posterior ankle tissues. It's going to get the Achilles, it's going to get that posterior capsule. And this band here is crucial because that's going to just really pull that tibia back. It's going to create that posterior shear. It's going to really stretch this out here. So you want to get there and just sit and hold it. And one thing you can do is you can put something underneath your arch because you want that arch to keep its position. So you put something underneath that arch of your foot, just bend, and just camp out here. You need a minimum of 2 minutes. At 2 minutes, you start making the tissue changes. Anything after 2 is going to be great, and it's kind of bonus time. Just hold it, keep it bent, and it's going to really, really improve that flexion in the ankle for you. Just sit there and just hold it. So you can do it without the compression band also, the voodoo floss. I like to do it with it because it's going to compress around the Achilles. And as you do it, it's pulling here too, so you're getting some more of that fascial traction, removing some more of those adhesions. So sit there and hold it. And you kind of vary. You kind of just push your weight on it here, stand up, or you can lunge forward. Once again, you need at least two minutes. Good. So hopefully that helps you guys out. So more on this stuff, you can visit us at westside-medical.com.